Greetings from your friends over at Fidalab, and thanks for watching this training video. In this video, we're going to go over how to properly collect urine samples using our proprietary UriPads and the included Aptima specimen collection kit. Our UriPads can be placed in any standard incontinence product, and two may be used side by side for a more successful collection of male specimens. To get started, we're first going to want to, of course, give our patients some water and clean the perineum area. So one cool thing about our PCR testing method is that it doesn't require the skin to be as thoroughly cleaned as you would with a standard culture method, as it only actually targets the DNA of bacteria that cause UTIs. But since, of course, fecal matter can still include this DNA, we want to make sure that the patient's perineum area is clear of any fecal matter. Now, once you have your soaked pad, take the specimen tube out of the kit and sign the patient's initials, the date of collection, and the patient's date of birth. Then place in a cup to make sure that it doesn't fall over during the transfer process. Rip open the UriPad like so. Take your pipette out of the kit and squeeze the bubble, and then place the nozzle in the most saturated area of the pad, releasing the bubble to draw up the sample. Once you have your sample collected, unscrew the cap and transfer the sample into the tube. Repeat this process as many times as needed until the sample reaches past the first black line for a 2 milliliter sample. Discard pipette when you finish and securely fasten the tube's cap. Once the specimen is in here, the preservative will keep it stable for up to 5 days. So if you're unable to get enough liquid from your first pad, simply secure the whatever sample you were able to get in here, place it in a safe place, and try again with more water and a new pad. It is fine to combine multiple samples from the same patient into one kit. So, once your tube is filled past the 2 milliliter line, don't worry if it's overfilled, that will not affect the test. But once it is filled past that first black line, place it in the specimen bag, secure it, and fill out the attached UTI rec sheet. You can then either use the supplied FedEx bags and return labels, or call your local sales rep to schedule a courier pickup. And that's it. Thanks for watching.